over the past few years, what we've done is shifted healthcare delivery in this country from disease-focused interventions into focusing on the individual, client, individual-centered care that brings all of these interventions to a nexus of the person. At the same time, we're following the President's principle of universal health coverage, which means everybody's life matters. It's a check-in to see what's working, what's not working, how do we adjust, how do we change things, how do we double down on successes and remove things that are not working, how do we motivate, how do we inspire our staff to go out there and do the best for every Sierra Leonean. That's what this summit is about.
And this time around, we want to reflect back critically to see where were we when we had the first National Health Summit, and where are we now based on the goals that we set, and where do we want to go as the Minister of Health, the custodian of the health of this country.
This, of course, is an important moment for not only me, but all the nurses and midwives within this country, because it's a period where we recognize and respect people for their hard work. And we are now looking at all the nurses where they are working, the midwives. If you are found doing very good work, then you can be recognized by the whole ministry and the government as well. So this is going to be very important for us because it's going to bring us together and to look at the work that we do and to ensure that next year we even put in more effort.
So we are expecting speed after the summit. We are expecting indices that should be reduced to reduce drastically and things that should improve to improve drastically if we all are together and move things further.
What the partners have told us is that what we're doing here in Sierra Leone is so profound, it's so important, it's so effective, it's so efficient that they would like to stay with us. What that means is what we're doing well, let us continue to do it well. Let us bring efficiencies, let's bring effectiveness, let's show value for money. If we do that, the limited resources we have, the few partners we have, will get the biggest bang for every buck spent in this country.
Jane, I think this summit, the National Health Summit, provides an invaluable opportunity to assess progress in the health sector in Sierra Leone since the last summit, or say over the last few years, but also to set a pathway for the future of the system. Yeah. I think we really recognize the importance of this event, as for this first objective. And in achieving really universal health coverage for the health system in Sierra Leone.
It's also important for us. So in addition to looking at progress, what have we done? What are the issues? What are the challenges? What are the game changers that we need to be looking into? I think it is an opportunity for us as development partners to really align and align to the priorities that we are determined to take forward, but also look at synergies, look at efficiencies, look at prioritization. So we are excited with that because that will shape the kind of support we give and how we give it as well.
As Joe Public or Bendu Public, we want at the end of this, no matter where you are in Sierra Leone, be it in Freetown, in Jereon, in Kailaon, in Kono, in Mabroka, in McKinney, in Bunth, no matter where you are, to be able to access high quality medical service. To have staff there that care for you, that have empathy for you, that are doing everything to ensure that you have better health outcomes.